Many private practice owners report examples of losing good staff because they couldn't match the compensation of a competitive offer. If compensation at a private practice is generally lower than at larger competitors like hospitals or health systems or others, well, what can you do? Are you just SOL or do you have options? Well, my guest today says you do. He helps his private practice clients work through issues just like this, among others, and he's got some ideas for us. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. It's usually what they want, but I think care is better. I think lots of people think care is better when it's the provider of care that owns the practice, because then any decision that's got to get made, business, clinical, whatever it is, those same people have to turn right around and take care of a patient. So feeling pretty good that the needs of patients are always top of mind. My guest today is Mike Lyons. Mike is an HR consultant and fractional HR leader to small and medium-sized healthcare clients, and he owns and runs Seasoned Advice. Mike has 20 years of HR leadership experience in multiple settings, but healthcare has been his favorite environment to support. Mike helps his clients reduce risk, improve staff retention, and recruit healthcare staff, among other services. Mike, this is a big problem we're talking about here, at least the fear of it and the reality of it. So thanks for coming on Practice Care.
Thanks for having me. Yeah, I'm super
Yes.
glad to be chatting with you, Carl.
Yeah. I love these topics. These are, who knows if we tackle the whole thing in one. It's such a big topic. And I got to believe that every practice owner, most practice owners, this is somewhere on their mind, usually most days of the week. Never know when it's going to pounce. So this is a really appreciated topic. So I'm excited to get into it, but we're not going to quite start there. That was a brief bio. I don't even vary the language when I say what I'm saying here. That was a brief bio, but that's what I asked for.
Mm.
Listeners hopefully are, well, probably are bored of that language, but sorry. Anyway, fill in the gaps. Tell us more about you, your business. Help us get to know you better.
Sure. Um, you know, I have just always been fascinated with providing service. When I was studying psychology way so many years ago, it's because I wanted to be of service to other people.
Mm-hmm.
And when I discovered human resources, it just felt like the perfect fit. And almost all of the work that I've done in HR has been in service-oriented businesses. And when I found healthcare, I think I really found my passion. It's the ultimate service-oriented
Mm.
business, and just have really loved it. And so when I decided to start my own HR consulting firm, I wanted to focus on healthcare. And I love that energy of a healthcare clinic and helping patients. And we've all been a patient.
Mm-hmm.
I've been a patient. I've had family members who've had health journeys, right? And
Mm-hmm.
and we've seen good health care and we've seen not great. And a lot of times the employees and the leaders in the practice make more of a difference than the physician themselves.
Mm-hmm.
And that's to me what HR is all about, is how do we get the most out of the human energy that we have in the practice for everyone's benefit, not
Mm-hmm.
just the practice, but for the employees themselves. How do we help them be their best selves? So
Mm-hmm.
that's what excites me about HR. And then I don't know, on a personal note, I'm a musician and have been in a
Mm.
few bands. And I was just thinking this morning, man, it's been a while since I've played some music, so I'm
What's the
overdue.
instrument of choice for you?
Well, the answer to that is my voice. Singing
Ah,
is my favorite instrument,
okay.
but I also play the guitar, and I've always played that in every band I've ever been in.
Got it. Got it.
Yeah.
I have to say, I like what you said about HR. I come from my primary background is large corporate America. Of course, there's HR all over it.
Mm.
But and when you said, get the most out of the human capital, they viewed that, my experience was, how can we squeeze the most out of our human capital
Right.
rather than even one, I forget where or when, but assigning numbers, and I get it, you have to do that to a degree, but
Mm.
just how can we squeeze?
Yeah.
And that's a very different approach than how can we even get. Get can be very positive. It could be, it
Yeah.
doesn't have to be this, look, you're a line item on the income statement, just like the rest of us are, and that's where you live, and you better be a good number. What do you want me to do? Like,
Yeah,
sure. It's just, you know what I mean? Like, but it's a little more human.
I think, and I think there's a fine line there because people do want to perform.
Hmm.
There's actually when I was getting my master's in HR, we talked about um, the theory X versus theory Y viewpoint of human beings. And theory X is that people want to give very little effort, they want to slide by, they want to do as little as possible, and you have to crack the whip. Theory Y was that people want to do a good job, they want to make a contribution, and you just have to create the conditions under which they can do that. And in
Hmm.
my experience, theory Y has generally been more accurate. And so I've kind of lived my career on the basis of that. And what that also means is that people can be motivated by metrics, right? So if I measure your performance, that can actually be exciting to be able to know how I'm doing. And
Hmm.
people who really are the right type of people for your practice, they're going to be energized by saying, "Oh, Mike is here and Carl is here. Let's see who can win this month." And so I want people who,
Hmm.
really enjoy that type of measurement. But there's, like you were alluding to, there's measurement that's maybe not so
Humane.
productive.
Yeah,
Yeah.
productive. Yeah. Makes me think when you said that, maybe the art of it is finding good theory why people for your practice. And
Yes.
and there's probably some X's out there. Now, maybe they're in the wrong position or they're just truly, you know, slothy or whatever.
Yep.
And then
Yeah.
of course, but is the entirety population no? So which kind of I didn't predict this, but this sort of you probably had this coming, right? This is how do we find more theory why people, right? Or how do we create the conditions where you've got those who want to be at your practice and thrive at your practice
Hmm.
so that when, competitors knock on their door and say, for plus 10 or 15%, we'd love to have you. And you can't match it. So it's like, how do you, the title of the episode, retaining staff on a budget,
Yeah. So
right?
so I
So
would
how
say the
often do
num
you see this? I mean, how often do you even see this happen? I said many. What do you see?
Yeah, all the time. I mean, every healthcare business has regrettable turnover because we do have some turnover that we're okay with, right?
Right.
But we all have regrettable turnover and we have more than what we would like.
Hmm.
And it only takes one person to leave your clinic for like a few more dollars that you just feel like you can't match for you to feel like the world is unfair and what could I have done better? And so it's extremely common. And that when I get approached by healthcare organizations to speak about HR, retention is usually the first thing that they want to hear about.
Interesting.
So it's very common.
Hmm. Okay. So what are some of the highlights of things that you talk about? Like the question I've got written here is, what are some advantages that a private practice even has over larger competitors? But maybe that's a more of a narrow way. So,
Mhm.
you know, help us with this.
Sure.
Are you just screwed if $3 more, comes along and you can't match it?
You might be screwed if $3 more. You might be screwed there, but but it's much more nuanced than that. And so there are a lot of things you can do as an independent practice, and there are advantages that you have.
Hmm.
A lot of times, larger businesses are hemmed in by pay practices that you don't necessarily have to worry about. They will only give a raise at this time of the year, and it has to be this percentage.
Mm.
That's a possibility. Um, and so you have more flexibility with that.
Hmm.
Um, a lot of times these larger organizations, and you kind of alluded to it, they are really crunching their offices in terms of staffing,
Hmm.
and not just frontline staffing, but management staffing,
Mm.
meaning those managers don't have the same latitude to spend time with their employees and connect with them and forge relationships that you might be able to in a smaller business. So what are the things I would recommend? I mean, and we can dive into all this, but
Yeah.
like the things that it takes to retain people are not always about money. It's about hiring well,
Hmm.
managing well,
Mm-hmm.
giving people growth opportunities to learn,
Mm-hmm.
and creating a place where they feel welcome and that they can grow. Well, none of that stuff has to do with money. And I have seen many, many employees tell me over the years that, I think I could make more somewhere else, but I love my boss and I love, the atmosphere that we have here. And so it is a verifiable fact that money is just not the only thing that retains employees.
Yeah, and I guess if you flipped it, you could say, well, no, I'll stop there because that's a bit too far-fetched. But what you were saying at the beginning was private practice flexibility. We can
Hmm.
throw spot raises at people. They cannot. We can, you know, you need to come in for 2 hours late because
Mm.
one person to ask, not six, you know,
And that's a great
um,
example.
you
A
know.
great manager can offer that flexibility. And, some organizations that are larger, what they will do is they'll implement these policies that are designed to be kind of a one size fits all because they're
Hmm.
so big and they're so fearful of legal action that they put structure on everything. They put structure on compensation. They put structure on attendance.
Hmm.
How, you miss 2 hours and 30 minutes, then you'll get this many points. If you call in on a Wednesday and it's raining, you'll get 3.27 points.
Hmm.
I I do not like those kinds of programs, but larger companies will often implement things like that. You don't have to do that. Yeah, like you said, hey, you want
Yeah.
to go see your kid's graduation? Awesome. You need to miss work or be late for that? We can work with that. Now, that doesn't always make it easy, but if you can offer that flexibility, then
Hmm.
it can be a real advantage for
Yeah.
you.
Yeah. And um, the structure, I mean, the way I think of it is I picture this conversation, with a hypothetical employee, just say, look, you just understand what you're getting into. They're very structured over there. And they have to be. They're not bad people. They're good people, but they're so large that if they we have a lot of flexibility here. If they took the flexibility that we have at our one office and put it over the entire, you know, thousands of employees, it would be chaos in there. And that's
Hmm.
not a criticism, it's just reality. So they need a lot of structure. And that structure is going to apply to you too, for example.
Yeah.
And so just weigh these things,
Hmm.
just weigh these things.
Yeah, and another thought that I would submit that sort of highlights the difference between a large company and an independent clinic. If you want to um, ask one of your employees to take on social media or marketing for your clinic, or do some tasks to help, with HR. You can do that. You can
Hmm.
say, hey, you know what, Sally, I think you're awesome. Like, can you take some photos for our social media
Hmm.
account? Well, that's not going to happen at a large company because that's being run
Yeah.
by someone else. That's
Or
off the
we've got
table.
this thing, there's this project that's got to get done. Who'd like it? There's some pay involved, you
Yeah,
know?
exactly. And that's a
Just give.
huge opportunity. And that's one of the reasons I personally, I started my career with a 60,000 person company, restaurant company. There's a crustacean involved in the name, if you can guess. And I progressively started working for smaller and smaller companies, and I really found that the smallest company that I ever worked for was my favorite opportunity because I got to know everyone, and
Hmm.
it felt like a family.
Hmm.
And I knew, the owners of the business, and that gives you a certain I don't know, it's rewarding to be in an environment like that, I
Yeah.
think.
Yeah.
Yeah.
It's funny. Grew up in a family business. My dad owned a pharmacy when there were still independent pharmacies. I worked, and then yeah, a number of years in very large companies, and 60,000, yes, similar size.
Mm.
And my God, the administrative burden. I mean, just go to anybody who works for a company, like a large company, and go, so annual review process. And if they're going to vomit because they hate
Yeah.
it. But you're right. I mean, private practice owner listening, you've got advantages. It may not be money advantages, but there's more to it. And so, which leads me to my next question. How do you put those advantages, into practice? I mean, I've got one thought, but I want to hear, you sort of started to say a little bit, but how do you put this into practice?
Yeah. Um, well, it all starts with hiring
Mm,
and knowing exactly what you want and what will fit your clinic and defining that ahead of time.
hmm.
And
And by that you mean more than the job description itself, right? You're thinking
yeah, I
about
mean,
just
like, what are our values? What
yeah.
matters to us?
Hmm.
And, usually with a big corporation, you're going to get these values like excellence and integrity and
Hmm.
stuff that's really doesn't mean anything.
Hmm.
And with your clinic, let's say you're an owner or you're the practice administrator, you can really define what does that mean?
Hmm.
Like, hey, we have a servant's heart, or we go above and beyond for our patients and for each other, right? And so
Hmm.
that makes it more real, and you can really look for people that align with your unique vision of what you want your clinic to look like.
Hmm.
And when you interview and check references and everything, you can evaluate that. Another thing that you can do is when you're onboarding your employees, you can highlight the small, intimate nature of your business. You can introduce everyone to um, people all across the organization.
Hmm.
Here's Joan, she's our CFO. Let's meet the billing team.
Hmm.
And in fact, you can have the doctors sit down with your new hires and say, hey, this is why we started this practice, and this is what's important to us. And I want you to come to me personally if you ever need anything. And
Hmm.
so you can't do that. The CEO of, you know,
Different building, maybe a
in a
different zip
hospital
code.
is in a
Yeah.
different state
Yeah.
or, and so that's a cool thing to be able to do
Hmm.
that will make an impact, on people when
Hmm.
they get hired in your clinic.
Yeah. One thing that jumped to my mind is as the owner, you have to know your local competition, right? We talk about it from a marketing
Mhm.
perspective, but we talked, Mike and I earlier about the flexibility and the independence versus the rigidity. You have to, it's worth knowing, some examples of that. So for example, they routinely double book. If you think you
Mhm.
want 12 minutes with that patient, you only get 6, too bad for you, as an example. We've talked to some of their employees, and here are some of the things that they've said, so that you can point to some couple of tangible examples. Grass isn't
Yeah.
always greener. The green money might be a little more, but the rest of the lawn is, burnt out. And are you
Kind of
sure? And
brown and crispy,
yeah,
right?
and just, weeds and
Well, that's a great, you gave a great example right there. If you, as an employee, let's say that you're a great medical assistant,
Mhm,
you're awesome.
mhm,
Well, would you rather work where the doctors in the practice are taking their time and spending the time, even if it's an extra minute or two, to answer questions that the patient has?
mhm.
Or would you rather go somewhere? And again, I'm not saying that every,
Of course.
large company or every competitor is like this, but would you rather go work somewhere where it's like you said, double booked? We don't have time for that. You're going to have to book another appointment, or sorry, call our, billing,
Hmm.
partner in the Philippines,
Hmm.
And again, I'm not saying anything is
Yeah.
necessarily wrong with that, but I'm
Yeah.
just saying that like you don't get you can often not get the same experience of
Hmm.
taking care of patients at a bigger business as you might get in your smaller clinic. And so
Yeah.
for me, I want to be somewhere where I can be proud of. I want to
Hmm.
be able to, when I go out to the grocery store and I have my shirt that says, you know, Texas Ophthalmology Clinic,
Hmm.
whatever the name of my
Yeah.
clinic
Yeah.
is that I
Yeah.
work at, I want people to go, oh man, I know them. I go there. They're so awesome.
Hmm.
I don't want them to see that and go, oh man, that company, they're always in the news and they don't
Yeah.
treat their workers right. I
Yeah.
mean,
Yeah.
I will never wear that shirt,
Yeah.
right? And it's because I don't feel comfortable with that.
Yeah.
So there's an
Yeah.
intangible value there.
Yeah. It's funny. I think of rarely, but not never. So in my industry, there's much larger competitors.
Yeah.
And when it comes up, what I say is something to the effect of, look, I'm sure there are good people in there trying to do good work, but they're
Yeah.
in a structure
Mm,
that requires them to standardize what they do. It's the only way they're going to stay profitable. I come from large corporate. I know what I'm talking about. And as long as what you need fits their standardized model, you might be fine. But if you need to tailor or change or go off the reservation, it's going to be a challenge for them. And
mhm.
maybe there's an analog to that. As long as the way you like to work fits how they structure work over there in that, very large system, you could be great.
Yeah.
But if not,
That's right. You have to make your
it's going to
choices. Yeah.
start to hurt. Yeah. You just got
Yeah,
to
that
know
you
what
have
you're
to make
getting into.
choices.
Yeah.
Every employer is different. Every potential place to get healthcare is different.
Hmm.
You kind of have to make your choices, and independent practices offer some certain advantages,
Hmm.
and huge multi-state organizations have their advantages too, and you just
Yeah.
have to capitalize on the ones the advantages you have,
Hmm. Hmm.
emphasize that.
Yeah. You made the
Yeah.
point about the words on the culture words that don't mean anything. In an episode I recorded not too long ago, I referenced the same thing. Have you ever seen the Netflix culture deck?
It's been a while, but yes, I
Yeah.
have seen that.
It
Yeah.
opens up with, they talk about culture and they've got these four words on a slide. I forget what they are. These are great sounding words. And the next slide is, these are what Enron had on
Oh
their
yeah.
wall when you walked in. And
Yeah, it was like
all the senior
integrity.
executives are,
Yeah.
yeah, yeah, do the right thing, whatever. And all the senior executives were, arrested for fraud. And so
Yeah.
the words mean nothing unless you live them and define them, say what they are and what they're not. It doesn't have to be this massive exercise, but
Hmm.
you know, Dr. X who's listening, your practice has a culture. It's going to have a culture. You can
Yeah.
define it or it can get defined on its own. So
Hmm.
which would you rather have it be? So yeah. Is there anything you think we actually hit a lot? It didn't take very long, but I think we hit a lot of the essential points. Is there anything though you think that we missed?
Um, you know, I think one thing that I would suggest, and I mentioned this as my number one suggestion, if
Okay.
you want to if you want to improve your retention, and it doesn't cost anything, is to show more gratitude for your team.
Mm,
It's how you conduct yourself and how you communicate with your employees. Showing gratitude um, has infinite ROI
mm,
because it doesn't cost anything and people love it. They want to
mm-hmm,
know that what they're doing is important, that
mm-hmm,
you noticed it, and it just makes them feel good. And by the way, it makes you feel good to
mm-hmm,
say, hey, Carl, man, I just am so grateful for our conversation. And you just had some great questions. And I love the platform that you're creating for the practices that listen to your show. Thank you so much. So you are. You are reinforcing the behavior that you
mm-hmm,
want to see also. So there's so
mm-hmm.
many benefits to gratitude. It's if there was one thing that you can do that I would have you take away from this topic of this episode, it would be just practice more gratitude.
Which is the next question. How can the
Yeah.
context is you've convinced listeners, like, yeah, he's right. I don't want to wait any longer and live in fear that tomorrow my best people are going to, get poached. What can
Yeah.
I do? Yeah.
Yeah, and you
Say,
know what you can
say
do
thank
and
you
say
with a
thank you.
specific. That thing you did the other day, that thing you just did, that was great. I just want you to know,
Mhm.
that was really good.
Yeah,
Thank you for doing so.
and if gratitude is hard for you, then what you can do is start practicing it in your own life.
Mm,
Every day when you're brushing your teeth, hey, what am I grateful for today? Um, what can is it the beautiful weather? Is it
mhm,
had a good night's sleep last night?
mhm,
What is it?
mhm.
And so practicing gratitude will make you a more grateful person, and then you'll bring that into the workplace.
Yep. Practice makes progress, just like in all parts of life, just like this one. Well, Mike, thank you. Thanks for coming on Practice Care. This is great. Huge issue, huge fear factor. Thanks for hopefully settling some of that down.
Absolutely. Thanks for the opportunity.
Absolutely. I'll have to have you back too, because I'm sure there's a lot of things we could
Oh,
talk
there's so
about.
many things we could talk
Yeah,
about.
yeah, yeah. Yeah. Good. So you gave us contact information. We're going to get that into the show notes for your episode. So anyone who wants to get a hold of you, they have yet another way to do it. Couple of points before wrapping up. First, subscribe to Practice Care. Why haven't you subscribed to Practice Care yet? Please do so. Not you. Please do so. Practice Care is one word, easy to find. We're everywhere. A couple of hundred episodes. If you're a new listener and you struggle with anything on the business side of private practice, there's a decent chance one of our episodes has touched on it. So check out the library. And finally, if you're someone like Mike or us and you serve private practice owners, or you're one yourself and you've got some experience on the business side of private practice, don't overestimate, don't overthink what that experience might be. Something you might think is dumb and boring and who would care? I promise you, lots of other people are struggling with it. In the show notes to every episode, there's a link, couple of clicks. We'll get you scheduled as soon as possible. Thanks very much, and until next time.